How are you doing today?
Good.
Okay, what can I do for you?
I won the Restylane contest, so they given me a choice to do what I want.
Sure.
My main concerns are
So you can do everything, right? They're going to pay for it all?
No, just $1,000 worth of product.
Sure, yes.
Yep, so my main concern is just under my eyes. I feel that the lines are quite deep.
Okay, so you feel that you have deep lines under your eye, okay?
Yeah.
Any other concern?
And maybe a nose bridge, I don't have a bridge. So yeah, I think that's the main concern with Asians usually.
Okay, any other concern that you have?
No.
Okay,
Just these two.
just these two concerns. Huh? Okay, now, of course, looking at you, the first impression that most individuals who seeing you the first time, just like me, seeing you for the first time, will have is that you are very dark. Your skin is very dark. So, to make you look better, is to make yourself look fairer. If yourself look fairer, means your face texture will look better. A lot of the old age changes, wrinkles, the development, the age spots and all that will improve. So you must avoid sun at all costs. So you must use a sunblock every day. Yeah, that's the least you could do. Now, of course, there are other features that are beautiful about you. Your eyes have nice double eyelids, but unfortunately your lower eyelids is not nice because one, there are dark circles. Two, they look uneven because one eye has a prominent muscle, the other doesn't have. One eye doesn't have eye bag, the other eye has an eye bag. Now, of course, you are concerned with the depression below as well, with a little bit of the fine lines, but these are not very, very obvious. Now, they're not very obvious. They can be improved a little bit with simple treatments, for example, like fillers with Restylane. But you can also use other treatment options as well, which includes Botox injection to smooth out the wrinkles, or surgery to remove the eye bag. And surgery can be done scarless. Okay, so there are limitations with each one of the treatments, and you have the option to choose. Okay, so filler to fill up the depression and to improve the fine lines a little bit, Botox to improve the fine lines, and number 3, to do surgery to remove the eye bag. Okay, so that's with the lower eyelid. Now, of course, with the nose bridge, the easiest thing for us to do is to fill it up with a filler. I don't think you're a candidate for nose implant surgery as yet because generally your nose is in quite good shape, maybe a little bit more flatter at the bridge of the nose, and it's very simply done with fillers. You know all about fillers because of the contest, so you know it's very simple. It's made of hyaluronic acid. It is found in the skin of all animals with backbone. It's found in you, it's found in me, it's found with the photographer and the cameraman, and it's a natural compound with minimal modification, made in factory. It doesn't come from an animal source, so you don't worry about mad cow disease, bird flu, and any other communicable disease from animal source. And then it will degrade naturally over time. So 1 minute treatment, I normally tell patients you have about maybe 10 days of a little bit of discomfort, sometimes bruising, sometimes swelling, and then you will see the results immediately. Okay. And depending on the type of fillers that we use, depending on the areas that we inject into, it can last for 1 year, 1.5 years, up to 2 years, depending on what it is. So straightforward. And so we are going to go and do Restylane, isn't it? Yes. Okay, so our suggestion, of course, my suggestion, of course, is to do a little bit of filler below the lower eyelid and a little bit on the nose. Anywhere else you think that you would benefit from Restylane or any of the fillers?
No, I feel that I'm comfortable.
You're comfortable otherwise, huh? Okay, so we'll go ahead and do these various treatments. Okay. Okay, so any drug allergy that you have?
Penicillin.
What happens if you take penicillin?
I get a very bad reaction of rash.
Rash, huh? Any other medical problem?
No.
Any reasons why you shouldn't be doing a filler treatment today? No, huh? No. So it's very, very straightforward. So normally what I do is, number 1, we've done a consultation, then you understand generally what it entails. Next, after this, we will take photographs of you to document what you look like before. And then after that, after the treatment, we'll see you again in 3 weeks. We'll do another set of photographs, see you after. And then you can bring a thumb drive and download all the pictures for you so you can see before and after what sort of difference you've made. And every patient should see a positive improvement. Okay. Then the third thing we do is, of course, for you to read more about the filler treatment, and we have very, very detailed information about what it does, what it can be used to treat for, as well as the risk involved. And of course, with any treatment, there is always a risk. The biggest risk that you have from any treatment is the fact that it's not nice enough. You think, I want my dark circles to all be gone, I want my eye bags to be gone, but like we discussed, you can fill up the line, fill up the depression, improve dark circles a little bit, you will not get your eye back. So the biggest problem is not nice enough. Or you think your nose is not tall enough after the filler injection. But of course, we can always add more later, yeah? So other than that, small signs of bruising, which I told you just now, small chance of swelling, a little bit of discomfort. Usually most patients don't take painkillers after that. There are, of course, risks of infection if you don't take care of yourself well, and then other injury-wise, it's very, very, very rare, okay, because the natural compound, so it disappears completely. And then the last thing, of course, I normally give patients a little bit of painkillers to take because it is still an injection. Some patients are very scared. So I have patients who are very scaredy cat. They say, no, 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 I don't want injection. So we can actually make them feel more comfortable by taking some form of painkillers. And I also put a numbing cream at the areas that we do injection because it's an injection. So if we put a numbing cream where we are going to do the injection, the numbing cream can get rid of about 50% to 70% of the discomfort. So, you know, you have injection in the arm, it's slightly painful, but if we put a cream there, wait for 20 minutes, after when we give the injection, the pain will be much, much better. Okay? And the whole treatment takes half an hour, 20 minutes for the cream to work, 5 minutes paperwork, and the whole treatment takes 5 minutes. Okay? Any other concern that you have?
No, no. Yeah.
Okay, then we are good.
Thanks.
Okay, let's organize this, yeah? Fillers is very useful for treatment on the lower eyelids, particularly if what you have is dark depression over here with a little bit of suggestion of wrinkles and dark circles. So what the filler does is to fill up this depression called the tear trough or the nasojugal fold, and these will become flat, so much so that after treatment you can see this is better, and this will give the impression that the patient from before to after has improved and looked younger. So with flash, without flash, without flash, 3/4 view from the right side, 3/4 view from the right side. And when she walks along the road, no one will know that she had this treatment done because it's completely natural looking.